Hello, welcome back. I am Em from Studio M Academy. If you are here, you're one of my current students and we are getting prepped and ready for weekend 2 all together. So in order to be prepared for next weekend, we need to have a nice general understanding of our movement terminology and our anatomical terminology. And the video after this will be a lovely summary of everything we did on the weekend. The full class structure that we created together, plus a couple of extra bits of repertoire that I've added in that we will be learning from this video and teaching first thing on our next day together. So let's follow the Studio M learning method, which is I ask a question, you say the thing out loud, so you have to try and use your recall and say it. If you can't remember, wait for me to say it, but I want you to say it out loud. I want you to write it down. I want you to do the thing or point to the area. And then I want you to teach somebody. So whether that teaching is to somebody who is invisible in your room, I want you to break down the word or the concept and you literally teach it to somebody like they are 2 or 3 years old so that you can really get down to the nitty-gritty of how you teach and how you can get your message across in its most simple version. You can use your hands, your voice, your movements, anything you can to teach the thing to the people or the invisible people in front of you. So first question we're going to go through, what is this position called? I'll move back. I know I'm a bit of a shadow now, but that's okay. What is this position called? If you said standard anatomical position, you are correct. Okay, what is an example of something that is superior and inferior? If you said your shoulders, for example, are superior to your hips, or your hips are superior to your knees, you are correct. You can do that all over your whole body. Superior meaning something that is above, and inferior meaning something, a structure that is located lower towards your feet. So if you could open up to page 10, I should have said that earlier. So our anatomical terminology is on page 10. Okay, so we've done superior, inferior. What about anterior and posterior? So all these words come in pairs, as you already know. Anterior and posterior. What are they? If you said anterior is to the front of the body, you are correct. Meaning posterior is to the back. The way I like to remember this, once again going back to our last few videos where I talked about remembering something, adding something crazy onto the word, anterior, I think of antennas, so at the front. And posterior, well, the postie just left your post back there. Posterior, post. Anterior front, posterior post. Why is that relevant? Well, it's relevant for lots and lots of different ways of describing where our body is in space, but we find it mostly in Pilates with our hips. So our hips here in anatomical position are nice and sturdy and still. If we want to tilt our hip from the top of our hip anteriorly, this is what it looks like. Anterior, see here, is coming forward. Yes, you might say, well, what about my bum? It's poking backwards, so isn't that posterior? It is, but we're talking about the anatomical position of our hip. And now the hip is pointing forward, which is anterior. So you will find a lot of people, including a lot of women, have an anterior tilt. We've carried babies at the front here, which brings a lot of pressure, and we get this nice little curve in our low back, which sometimes can result in pain and injury. So we really want to try, if we can, to pull that back in. See that movement there? We've got the big arch. We draw it back in by strengthening through our core, strengthening through our back. That's our anterior tilt here, and then this is our posterior tilt here. So that's anterior and posterior. Let's do medial and lateral. What is medial and what is lateral? Super simple. Medial, midline. Medial, midline. Lateral, away. Medial towards the midline, lateral away from the midline. Perfect. So after medial and lateral in your books, we have got proximal and distal. Proximal, a structure located towards the trunk, and distal, something located away. For example, we have got our, if you remember our bones in our arm, our radius, yeah, and our ulnar. So the proximal radio-ulnar joint is at the top here, closest to our torso. Our distal radio-ulnar joint is down by our wrist. Same thing in our shin. We've got our tibia and our fibula. Those two have a joint at the top, just underneath what we call our knee. Yeah, so that's our proximal tib-fib joint. And then we have our distal tibiofibular joint. Yeah, so that's proximal and distal. So if we're following the book, we then go to superficial and deep. Well, that's quite self-explanatory. You would have used that language in everyday life already. Superficial, you're sitting on top of the water, so on top of the skin. Your skin is superficial to your heart. Your heart is deep. For example, that's just a general example. Okay? So from there we move into our movement terminology. So you've got your knowledge check there on page 13, so please do your knowledge check. And then after you've done your knowledge check, which is literally filling in examples for each of those things we just ran through, you'll then turn to page 14. Give yourself maybe 10 or 20 minutes and then come back and do your memory recall. Memory recall means you don't turn back and look at all the answers. You literally just set your timer, as it says in your book, maybe for a minute or two, and see how many words pop into your head. How many? How many? Write them down. Then what you can do is come back the next day and do the same thing and see how many words you can recall. Pop them on the paper, but cover your answer from yesterday so that you can't see. The more we can try and do this at least every day or two, the more it's going to become like a second nature, a second language, because anatomy and anatomical terminology is literally a second language, okay? So if it doesn't sink in straight away, please do not worry, it will. It will with time, and it will with practice, and it will with intention. Okay, so the next movements we're going to quickly run over are our movement terminology. So if you could please turn to page 16. You've got it before you begin memory recall for that. And then we move on to page 18. So we've already run through a few of these, but for those of you that want a little recap, once again, I'll ask you the question. I want you to do it before I give you the answer. Okay, show me flexion of your elbow. If you did this, you are correct. Show me flexion of your knee. If you did this, you are correct. Show me flexion of your hip. If you did this or this, you are correct. Show me flexion, show me dorsiflexion or dorsiflexion of your ankle. If you did this, toes to shins, you are correct. A way you can remember dorsiflexion or dorsiflexion is by thinking you're kicking a door. Yeah, so your toes are coming up towards your shin, dorsiflexion. Now show me plantarflexion. If you did this, yeah, you point your toe towards the ground away from your shin, that is plantarflexion. I think of plantarflexion as I'm planting a plant with my feet. I gotta tap the soil in, I'm planting the feet. Oh, I'm doing tap dance now, yeah? Planting the feet for your tap dance. That wasn't the aim to do tap dancing, but you can plant, you're planting the soil, plantarflexion. Okay, so then we have got our, what about extension of our hip? So to find extension, we first have to move into a starting position. So starting position would be flexed. Ending position will be extended here. So see, our hip is flexed and now our hip is extended. Yeah? Awesome. So what about extension of our elbow? Same thing. We have to start at a flexed position and we have to extend at the elbow. Shoulder, same. Shoulder's a little bit different. We're already here in anatomical position. Extension of your shoulder is bringing it back behind you. And as we talked about in the last video, flexion is bringing palms face floor. Flexion is bringing your shoulders and arms up towards, your arms and hands up towards your shoulder and then up even higher. Okay, so let's do abduction and adduction. Abduction of your, let's go abduction of your leg. What is that movement? Abduction. Abduction, taking the leg away from the midline. We just talked about the midline, straight down the center. Abduction. Beautiful. So abduction is when the leg is coming up. Yeah, and adduction, we're adding back in. What's that movement of the hip? Of the leg? Yes, adduction is adding the leg back in. We abduct away and then we add back in. I think of abduction as being abducted by aliens, and then adduction is bringing it back in, adding something to your body. Yeah? Beautiful. Okay, next one, we have got abduction of your shoulders, the same, and then adduction. All right, let's do internal and external rotation. So I'll come up close of your shoulder, internal rotation, and then what's external rotation? External rotation. Yeah, so if you're a physio student and doing this course with us, you will already know we usually assess out here. So we have got internal rotation, and then we've got external rotation. Okay, and same for the hip. Can you demonstrate internal and external rotation of your hip? Okay, I'll demonstrate for you. I'm gonna lift this leg up so that you can see, and I'm gonna face my foot towards you. Internal rotation, external rotation. When your knee is bent, it can look a little bit different. So this is internal rotation, yeah? Our foot comes out to the side, but our thigh bone rolls in. Internal rotation, and then external rotation out to the side. So same thing with our arms, internally rotating, externally rotating, yeah? So same out here, internal rotation, external rotation as we did before. Okay, so that's internal rotation and external rotation. Let's see if we've got anything else in your textbooks. Oh yes, we've got our circumduction. We ran over that 2 videos ago. So that's your shoulder joint. We can do circumduction. Beautiful. Okay, that's just moving in all planes of motion, which we have learnt is your sagittal, your frontal or coronal, and your transverse, yeah? Twisty, twisty. Sagittal, forward flexion and extension. Now flexion and extension, just remember again, just a little recap. Your flexion is when you bring 2 parts of your limb or 2 bones closer together. So you can see here, I am bringing my hand and my arm up towards the top of my arm. So 2 points coming closer together is flexion, and extension is always taking 2 points away from each other. Okay, I know we learned that last week, but just a little recap so you can write it down in your notes and teach it to somebody. Okay, we have got pronation and supination. So this is with our wrists here. If you're doing physio, you will know that this is how we assess pronation and supination, sitting on a chair. So in Pilates, you can think of this as supination, you're holding a soup. This would be when you have some weights or a ball in your hand, or when you're doing offerings, we're supinated here. And pronated is when your hands are down towards the ground. We've spilt the soup now. Yeah, we've spilt the soup. And you are in a pronated position when you are doing planks, having your hands on the floor, all that sort of stuff. So that's supination, pronation. And then we've got a range of movements that we do with our scapulars. So our scapula, if you can remember, is our big wing bones on the back of our body. And in fact, I might just our scapula are the big wings, the big wing bones on the back of our body here. So with the big wing bones, I'll just bring Skelly the skeleton a bit closer for you. Our big wing bones here, you can't see them too well, but they can go straight up, which is elevation, and come back down, which is depression. So I will just show you with my own scapulars if you can see me. So elevation, they rise, depression, they come back down. Elevation is like your shoulder shrug you might see people do in the gym. And then depression is when you hear people say, lower your shoulders down, push your shoulders away. That's depression. So they elevate, then they depress. Probably pretty bad view, sorry. And then we've also got your, if you bring your arms out in front of you, the next page will go over your protraction and your retraction. So demonstrate that for me and then I'll show you. I'll let Skelly stay here with us. So, protraction. Arms come all the way forward, our scapulars come apart. See that? So protraction, then retraction, our scapulars pull back together. So our scapulars move apart, our scapulars come back together. They move apart, they draw back together. That's our protraction and our retraction. Protraction, retraction. Amazing warm up for our scapulas and shoulders when we're doing Pilates, and you can simply do it like that. Hands out in front. You can do your flexion of your wrist. You can have your wrist pointed. You can be holding something. Let's protract, retract. Or if we're using non-anatomical words, we are going to keep our body really, really still and send our hands to the front of the room, letting our big wings on our back separate apart, yeah? Now we're gonna draw those wings back together and draw our body back in line to where we started, or squeeze a little bit further back, okay? So protraction and retraction. All right, and then we've already covered dorsiflexion and plantar flexion. Then you come to the next page, which is 21, and I want you to go through and spend some time filling out all the answers there. So it asks you to do the movement, yeah? And can I remember the movement? Can I demonstrate it today? If you can't, it doesn't matter, come back, put a little date for today, like maybe you'll have one line. So you'll do, this is your page 21. The movement is here. Can I demonstrate this? You might put the date at the top and then tick, 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 no, 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 tick, tick, tick. And then you might write another date in 2 days or 3 days or 4 days. And then keep coming back and seeing where you get to. Everything is progression, okay? Even if you can only remember one of them today, it doesn't matter. You'll remember more, I promise you. Okay, and then what I want you to do is write down next to that the primary joint and the body region. So you would have saw, for an example, flexion can happen at the elbow. Flexion can happen at the shoulder. Flexion can happen at the hip. Dorsiflexion and plantar flexion happen at the ankle. So just going through and trying to remember what joints can do abduction. We've got our shoulder joint and we've got our hip joint. We also have like our thumb, but don't worry about that. It's not relevant, okay? Just doing the main movements that you'll come across in Pilates. Okay, so you'll do that memory check for me, for yourself, not for me. And then once again, give yourself a few hours or a day and come back and do your memory recall, okay? We've done the planes of movement already. I briefly ran through that before. You've got your sagittal plane once again, that you do flexion and extension within, yeah, for all body parts, including your feet. And then we have got your coronal or frontal plane. That's where we do abduction, adduction. And then you've got your transverse plane, which is where we can do your spinal or torso rotations, yeah? Look at that, all that rotating, whoo! Any kind of rotation. Internal rotation, external rotation, all of that stuff. Okay, I think that is so awesome. Go to your memory recall page. You can write out all the stuff about that. And then cueing lab we are going to do on Saturday. I cannot even wait. It's going to be fantastic. We are going to run through the 4 types of cues, plus within each type of cue, there is a whole plethora of different ways you can use that style of cueing. And we are going to practice all of them. So if you could do me a huge, huge favor and read through the cueing lab from page 25. I know there's a lot of pages and reading is like not that fun all the time, but give it a go if you can, okay? So just a quick rundown. We've got our visual cueing, our verbal cueing, our environmental cueing, and we've got our tactile cueing. And then from there it goes through how we can use all of those different types of cues, examples, descriptions, and start practicing if you can, if you have time, okay? Start practicing. So we are going to end that there. In summary, we've just gone over our movement terminology, plus we have gone over our anatomical terminology. I hope that's made sense. Please comment in the comments if it doesn't make sense. Sorry, I've like cut off my legs here. I'm not doing so well with the filming, so I'm a bit tired. But anyway, we're showing up, we're getting it done. I'm so looking forward to seeing you all this weekend. And the next video will be your full routine that you created this weekend all together. See you soon.